Good afternoon. Thank you for joining us this afternoon. Governor Parson, Dr. Randall Williams, the Director of the Missouri Department of Health and Senior Services, met upstairs with the heads of MU Healthcare, Truman VA, Boone Hospital, as well as our first responders, our police department, fire department, to really get a lay of the land here in Columbia and really learn about some of the challenges that we have, what our local needs are. Let me first say thank you to the governor for his leadership on this issue. I've been coordinating with him as far back as a month ago, certainly 2 weeks ago, and as recently as Sunday on a phone call with the other mayors of Kansas City, St. Louis, Springfield, and Cape Girardeau. I appreciate his personal visit here to really understand some of the barriers that we have, and so that Dr. Williams can go back and really make some of those adjustments to accelerate the testing that we foresee needing here in Columbia, as well as protecting our first responders and healthcare providers. Happy to take questions. Governor, if you want to say a few words, do that as well.
Mayor, thank you very much. One of the things I wanted to do this week, we've been traveling around the state, is make sure people did understand what was available on the state level when the executive order, what that meant to a lot of local communities, what that was going to be able to offer them as far as supplies goes, as far as funding goes, and how we were going to implement that, and where we're at on the testing process, because that's one of the main questions we get every day at the office, is where we're going to be on that testing level. I think the good news is the testing levels are going to increase dramatically, probably in the next, as days go by, and I would say by the 1st of April, we're probably going to be at the capability we can do maybe 10,000 tests a day. By combining with the private sector, along with the state facilities to do that. I do want to thank Washington University for them stepping up and helping, and also for MU here in Columbia for their leadership and helping with the testing side of this. Those were significant things that occurred just in the last week or so that they're going to be able to help with that. So we're thankful for that. I think the other thing that we're looking at with the emergency declaration that I had done last week, making sure that we get the supplies out we need for the frontline officers, whether that's the emergency room personnel, whether that's the ambulance drivers, whether that's our first responders all together, to be able to ensure we got that equipment. The PPE is what's referred to that. So the money being able freed up in the executive order was about $7 million. We'll be able to get that supply out. Probably some of those products will be going out in the next day or so, going to the local communities, and to be able to get that instigated there. The other thing I think we also is look at what do we have from the guard level to provide if we need it for temporary or for mobile testing. What do we have for tents? What do we have for supplies there? Where can we set them up? What can we do? I think those are all the things I want the local levels to know that we're here to help, to engage in that. We also want to know that the businesses around the state are going to be affected by this. There's no doubt that it's going to have a dramatic effect on the communities in the business arena. And we're working every day to try to figure out, okay, what should some of those solutions be, whether that's to the unemployment side of it, to the business side of it. What role are we going to play? What is the federal level going to do, which is the big unknown out there, as we all see right now, and where they're going. But I think it's really important from the state level to see what we're going to be able to do, what we can do that we have control over. So that was one of the things I wanted to talk to the mayor and some of the leaders in the community today about, to make sure we're here to support them. I might touch just real quickly on the school closings. There's been a lot of talk about that over the state. I made the decision to leave that up to the local levels. If you look at Missouri, there's 540 school districts in the state of Missouri. All of them are very diverse. All of them are drastically different. It's much different whether it's be here in the Columbia school systems or whether you're in Hayti and the Boot Hill. A lot of schools do not have daycare capabilities. They have no place for kids to go unless the kids go back home. Parents are working. And all of those things we try to take in, and we felt like the local levels, the elected officials there, would know best how to do their schools. So that was the reason I made the school decision. Earlier today, we shut down the casinos in the state of Missouri, 13 casinos here. We did that simply for the protection of the people in and out of there. And I think it's also important to make sure everybody understands that this changes daily. This whole scenario is a road we've never been down before, and it just changes daily. So we're doing everything we can, one, to support the local communities, everything we can have at the forefront at the state level, we're putting forward to try to make sure to serve the people of Missouri. But at the end of the day, it is going to be personal responsibility. There's going to be a part of the future of what we're doing to fight the coronavirus. On that, that's going to be a key to that to do. So With that, we're glad to take a few questions.
Do you expect revenues to decrease for next fiscal year because of this virus? And do you have a plan for what you would withhold under that scenario?
Well, I think fortunately is one of the things we did. We were fortunate enough to put $100 million back in state revenues in case we did have a problem, much like we did the flooding scenarios last year. Is it going to affect the state? Yes. Is it going to affect the economy? I think we all know that. I think the cities here, the mayor and some of his councilmen upstairs are business owners. It's already having an impact. You know, when you lose 50% of your business in one day and that continued on, that's going to have an impact. It's going to have an impact on the quarter. So, yeah, we're working on it.
Summer, go ahead, Summer.
Wesley Bell had said that he was going to release nonviolent criminals from the jails. Is that something that you would support, and would you support looking at doing that with the Department of Corrections and Prisons?
Yeah, right now those would be local decisions of what they're going to do on the local level. We haven't got to that process of what we would do in the prisons right now. You know, our correction facilities, we're just very concerned about who comes in there, and we know that's very receptive to the coronavirus, so we're doing everything we can right now. But right now, our priorities are the people out there with public safety and the public health of the people out there in Missouri right now.
You mentioned Friday the president released funding from the SBA as emergency funding. Are you looking into declaring Central Missouri a designated area so we can access that small business funding?
We're actually in the process of that today. When I go back to the office, I would hope that those are ready for signatures and we get them sent off, because that's a huge, it's going to have a huge impact on Missouri, but we're signing that and hopefully be part of that.
Governor, you mentioned the testing numbers. Would you mind repeating that number again? And what is that benchmark based on? What are you looking at that
Let
you think
let
that's
Dr. Randall's or Dr. Williams kind of address that. He can go through that for you.
Yeah, thank you. We are transitioning fundamentally in our approach to more surveillance. As Tony Fauci said on Sunday, you know, in times of challenge in America, and I think of World War II, we always kind of harness our industrial might. And so as Tony said on Sunday, we will be able to have a throughput of doing 280,000 tests per week by next Friday, and that's just the start. We're incredibly fortunate that we worked with WashU. They went online today to do testing. Tomorrow we've worked with the University of Missouri. They're going online with testing. We worked with the University of Missouri Hospital today. They're working with a group. We have a lab in Lee Summit. So the result of that is that there are many clinicians, and you know, I was one for 30 years, who are frustrated that right now to test patients that just have a fever and a dry cough, they can't get access to that. Our strategy going forward to mitigate this disease in Missouri, the goal is to keep as few people with infections as possible, is that anybody with a dry cough and a fever, which is a hallmark of this disease, starting in April 1st, we want to set up mobile sites, both public and private, as you've seen in St. Louis and Springfield, away from hospitals to get everybody tested, isolate those people, and then through social distancing, do what other successful countries have done. I remind you that today, China only reported one case yesterday, new case of COVID-19. So we think we have the wherewithal to do this, and that's where we're going.
April 1st is still a couple of weeks.
Steph,
Why April 1st?
Okay.
Why not
Let's
sooner?
take one
One
more
more.
question, and I've got to get back to Capitol.
Okay.
We've got a lot of stuff.
Well, what about asymptomatic carriers? Don't those people need to be tested too?
Let's let somebody else ask a question.
Yeah, Missouri's tested fewer people relative to population than any of the surrounding states. Do you have an explanation for why that's been the case up until now?
Well, again, on our criteria, we have no backlog. We test everybody immediately within 6 hours, and the next day that they come in. But up until this point, the limiting factor has been the control agents coming from the CDC. So what we didn't want to have happen is it's happened in other states, whereas they ran out. So that you have a person on a ventilator where a physician really needs to know do they have COVID-19, and you didn't have the test because of it. So we have purposely rationed our test. We will now be moving into a new area in about 10 days in which we won't be doing that. We will broaden our categories within the state lab, and also, as these other tests come online, broaden those categories.
Okay, thank you so much.